PaducahDentalCare is here with me today, and we're going to be answering some of the questions you guys have called in about dental care, oral care. You ready?
Yeah, go ahead, let's do it.
All right, you guys. The first one says, what are the best ways to keep my teeth white?
That's a good question. So to whiten your teeth or keep your teeth white, it involves a combination or multiple strategies, I guess the best way to say it. The first thing and foremost is you got to brush regularly. You got to brush at least 2 minutes in the morning, 2 minutes at night before you go to bed, and that's the minimum. After that, regular flossing. You need to go see your dentist regularly, because the thing about that is you can brush all day, but our hygienists are able to get those tough stains off your teeth that you can't just get off yourself. So that by doing those things, that'll get your teeth white. But then there's also things like whitening toothpaste, or you can buy Crest white strips and stuff like that at the store, and they do pretty well for the most part. At our office, we do professional whitening, which is probably the best way to whiten your teeth, and it's about a 2-hour appointment, but I'm telling you, it gets good results, and people have had amazing stuff with that. And finally, it's just being mindful of habits that stain your teeth. Like, I'm not saying coffee's bad, but if you drink a lot of it, it can stain your teeth, or red wine, or tea. Drinking from a straw can help not stain your teeth. And there's things like smoking. Smoking is terrible for your teeth. It stains them terrible. So I know a lot of these things can be hard for some people, but at the same time, it's a price you pay if you want white teeth. And white teeth, it makes you look younger and better, and overall, that's what people want. So good question.
This caller wants to know, my dentist doesn't do sedation, and I need a lot of work. Can you do it?
Yeah, so at our office, the first thing you do is you need to call our office so we can review your treatment to see what treatment's needed. From there, we can see, we got to look at your medical history, and yeah, we should be able to sedate you. At our office, we do both oral and IV sedation. The good thing with sedation is we're able to do a lot of work in 1 to 2 visits. So that means you don't have to be running back and forth to your dental office. You can get it done in 1 or 2 visits. And from there, at our office, we do free oral sedation, which is a good benefit to patients. And like I said earlier, the sedation is great. It's just not for the high fear. It's for people on the run, want to get a lot of stuff done in 1 to 2 visits. And yeah, just call our office. We can give you a pill, get the work done, and it's that easy.
This person says, I'm in my early 40s and want straight teeth. Does an Invisalign work?
So Invisalign is a great tool. It works great. We have a lot of older clientele who will do Invisalign because they don't want to wear the metal braces. And these are clear aligners. The thing with Invisalign, though, is in order for it to work, you have to be compliant. You have to wear the trays. If you don't wear the trays, it's not going to work. The other thing is with Invisalign, anytime you eat, you can take the trays out, but you got to have good oral hygiene. You got to brush your teeth. I've seen people get Invisalign and then they have a mouthful of cavities because they don't take care of their teeth very well. So like I said, Invisalign's a great tool. You got to do your part, though. If you want to make it work, you got to wear the trays. I can't stress that enough. But yes, Invisalign's great. We do it all the time. Good question.
And super quick, I broke a front tooth. Can you get me in today to get it fixed?
Yeah. So so at our office, we get you in. We can probably fix it today. This is the thing. In our office, we leave a column open for stuff like broken front tooth, toothaches, whatever it may be. Call us today. We can get you in. If you want to be sedated, we may have to schedule you for a time where there's an opening, but no matter what, we can always get you fixed up and out of pain, or whatever it may be, or like you want your front tooth fixed, so we're able to do that.
Perfect. Thank you so much for being here with me today. If you'd like to revisit this segment of Health Experts, log on to WPSTlocal6.com/healthexperts. Up next, Brandon Heine from Lindsay Funeral Home is going to be here with me, and we're going to talk about pre-planning. That's after this on WPST Local 6 Midday.
My house was built in the late 50s.